Stationary biomarker variation is often confused with physiological stability. When the distribution of a biomarker's fluctuations does not change over time, it feels natural to think the patient's state is controlled. But stationarity describes fluctuation distributions, not the underlying physiological trajectory. A biomarker increment process is stationary if its joint distributions are invariant under time shifts. This definition concerns the distribution of changes, not the level of the biomarker itself. Nothing in it constrains what happens to the patient's accumulated physiological state. A stationary fluctuation distribution can remain unchanged while the patient's physiological state deteriorates without bound. At every moment, the distribution of changes looks the same, but the state itself accumulates those changes one interval at a time. The variation looks controlled, the patient's trajectory is not. Consider a physiological signal whose distribution of changes does not depend on time. The increments are stationary, yet the patient's state accumulates those changes one measurement at a time. It drifts without bound toward deterioration. Stationarity of the increments does not prevent the state from diverging. Even when the mean physiological change is zero, state variance can grow indefinitely over time. This growth is invisible at the level of the fluctuation distribution. At each interval, the distribution of changes appears unchanged, but the spread of patient trajectories keeps widening. Instability emerges only along individual patient histories. Stationarity is a property of fluctuation distributions. Homeostasis is a property of the regulated state. A patient can exhibit stationary biomarker variability and progressive physiological deterioration at the same time. Confusing the two hides structural clinical risk. Stationarity of fluctuations is compatible with unlimited state drift.